We now come to talk about research and strategy, a session on research and strategy. This morning we had some high-level guests where we talked about national strategies, talked about the importance of being gender transformative, the importance of partnership, the challenges in terms of capacity building, in terms of other issues. But now we come to some really two very interesting and helpful sessions. The first one is going to be moderated by Irina Dincu, who I'm going to introduce now. And I just ask you to, again, please, when time comes for the questions, please come to the mics and for the interpretation for our for the webcasting. So Irina is the moderator. She is the Senior Program Specialist at the Center of Excellence for CRVS Systems here at IDRC in my program. And in her capacity, she provides strategic directions. She provides technical support for selected GFF countries for integration of CRVS in their reproductive, maternal, newborn, child, and adolescent health investment cases. She's also a great team player, and she's contributed in a number of ways to our other components or our other pillars of the Center of Excellence, which is the knowledge hub, and also for the capacity building component and for the research component. Irina has worked, before joining the Center of Excellence, she has worked at UNICEF and Plan International, among other places, where she has contributed to birth and civil registration programs in Cambodia, Cote d'Ivoire, Burkina Faso, and Chad. I'll stop talking about Irina. Now she will introduce other speakers. Welcome you all to enjoy this panel. Thank you.
Thank you, Montasser, for the introductions. And welcome everyone again. I hope you came back from lunch with a lot of energy, either from the suites or from the lunch itself. And you are ready to listen to some of the best speakers into the field of gender and development and CRVS, obviously. And we're going to discuss this afternoon with you a topic which is very near and dear to our heart here at the IDRC, and this is research. And we're going to touch together as well on strategies. How do we develop strategies at country level? How do we engage with partners and stakeholders at country level to really achieve sustainable CRVS systems? And I just wanted to share with you, first, who are our esteemed panelists here today, some of whom I'm proud to call my friends. And I'm going to start with the very last panelist, Mayra Buvinic. She is a senior fellow, both of the Center for Global Development and Data to X, an initiative of the United Nations Foundation. And previously, she was Director for Gender and Development at the World Bank. She also worked at the Inter-American Development Bank, where she headed the Social Development Division and was a founding member and president of the International Center for Research on Women. Sitting next to her, we have Josie Perez, who is a gender champion, and she's a CRVS expert. I think you met her this morning already. She works as a deputy national statistician at the Census and Technical Coordination Office of the Philippine Statistics Authority. And sitting next to her there is our friend and colleague Martin Bratschi from Vital Strategies. He is the Deputy Director, Technical Implementation for the CRVS Improvement Program. He is a CRVS and public health expert supporting technical implementation of CRVS system strengthening and mortality measurement activities in 15 countries. Martin's focus is on improving CRVS system architecture and vital events registration coverage by ensuring that all known births and deaths are registered, implementing verbal autopsy as part of the CRVS systems, and finally developing guidance to promote existing and emerging best practices for the improvement of CRVS system around the globe. Well, last but not least, my esteemed colleague from UNFPA, Romesh Silva, who is the technical specialist for health and social inequalities at the Population and Development Branch at the New York headquarters of the United Nations Population Fund. Romesh leads the fund's technical work in the areas of civil registration and vital statistics, population data, and demographic estimations in humanitarian settings and youth mixed migration. He has done very innovative work in gender and CRVS in Morocco, and I'm sure that he's going to share this later with us today. I just want to give you a few considerations before we are going into the main part of this panel. And I give the floor to the panelists who will speak. But before doing that, I wanted to share with you a story, because the topic of this panel is research, right? And in particular in Africa, and I'm talking about Africa because my experience for the last many years has been there. We say that, oh, we do not know why people are dying, and we do not know, the causes of non-registration and births, and we do not know anything about marriages. But the truth of the matter is that communities know about this. They know about every birth and every death and every marriage because they do have festivities around it. So my question would be, how do we capture their knowledge and translate it into registration within the CR system? That would be, I think, one of the questions which I would like to address to my panelists. And just to share with you that I grew up in Romania, and in the 80s, we had a movie which was called Roots, based on a famous novel by Alex Haley about an African slave called Kunta Kinte. And Kunta Kinte traveled from Africa. He was from Gambia and moved to the United States. And 150 years after, his great-grandson, Alex Haley, has started to do a research to see where Kunta Kinte was coming from. And this research brought him back to the Gambia, into the very village that Kunta Kinte has left. And there was there a griot, and for those who are not familiar of what a griot is, he is a storyteller, and he's the custodian of what the community knows about marriages and deaths and the families and the history of the community per se. So when he went back there, the griot was telling the story of the Kinte family, and they said, well, into the 1980s, there was this family, Kuntas, who were having 4 children, and one of them was taken away, and we do not know anything about him. But the rest of them, they got married, and they have 5 children, and 3 children, and 4 children. And then Alex Haley stood back, and he said, well, I am the great-grandson of Kunta Kinte. All this to say that actually communities know everything about all these vital events we are here today to talk about. My question to you all is, how do we capture them into the systems? Just a few considerations. When we look at the available CR data, we notice that at national level for birth registration, there seems to be no discrepancy between registration of boys and girls. But if we go down and narrow it at whatever level, the lowest level, let's say at the commune level, we will notice that discrepancies still remain. So how do we capture the most underserved, mostly women and children, into the systems? Another thing, death registration completeness data disaggregated by sex is not available. And I think Romesh will tell us a little bit more about that. Furthermore, few, if any country, has specific strategy to address death registration, and in particular registration of female deaths. So how do we work about that? Just as a title of example, UNFPA has done a study in Guinea-Conakry, and colleagues from the government are sitting here, and we have seen that from 1.6% of all deaths were registered, and 86% of those were of males. So what's the reason why? Why is this happening? We learned from colleagues at UNFPA this morning, and also at the statistics division, that marriage registration poses a problem for women, in particular, on economic inheritance. So how do we bring this forward? All this to say, there is a lot of things we need to discuss about data, right? And I would like to commend my colleagues, in particular those of UNICEF here among us, who have done a lot of research in birth registration. Yet this is not enough. A lot remains to be done in marriage registration, even though there are very, very shy steps undertaken in research around child marriage. And unfortunately, just to go back to what Oliver was saying today, we do not know the causes of deaths of people in the communities in Africa, but this is also valid in other low and middle income countries. and we do not know why people are not registering. So it's also to say that maybe research would have to play a major role. We are learning some of the reasons from the multi-indicator cluster surveys and demographic and health surveys, but not much. And we do believe that there is a knowledge gap, and perhaps there is time for us as a community to go towards more research and engage more among ourselves, but also with the communities on finding the reasons why these people are not registered. Well, with this, I'd like to turn the mic to our panelists, and I'm going to invite Mayra here to tell us a little bit about the issues surrounding gender and CRVS from a gender's perspective. Mayra?
Thank you. Thank you so much. And it's a great pleasure to be here. And thank you so much for inviting me. And this is, you know, it's wonderful after all these years to see that gender is mainstreamed into CRVS. I'm really delighted and impressed. I will probably have to repeat a lot of things that already have been said. So hopefully I won't bore you, and at least, you know, maybe give it a little bit of a different twist. But what I'm saying now was said this morning by the speakers, most of them. So anyway, you know, what is the state of the CRVS? We already have said it, but about 2 billion people globally do not have birth registration, and about 2 billion people don't have a legal identity. So there is a lot of work to do. What is a well-functioning CRVS system is particularly important for women and girls. And I'm going to go into more detail of why it is particularly important. But I want to say something else here that I think is very important. This is a two-way street. CRVS is very important for women and girls. But if you want to achieve a fully strengthened CRVS system, you will need the help of women and girls. It will be a lot more efficient over time if you rely on women and girls to make your system universal. Otherwise, and I think that this is the great challenge for the Center of Excellence and for the CRVS systems in general in terms of strengthening them. If you forget about gender, and if you forget about all the dimensions that go with gender, the very real risk is that as you strengthen the CRVS systems and you are moving towards a universal system, you will leave excluded people. And who will be those excluded people? A lot of them will be women. And on the other hand, if you want to strengthen a CRVS system and make universal registration, perhaps one of the most efficient ways of doing it is relying on knowing exactly what are the constraints and the biases that women and girls face with the CRVS system and really tackling those. And you will increase rates dramatically. So anyway, believe me. And I think one of the things that we really need to do is a costing exercise on this, and to show the costs and the benefits of using women to strengthen the CRVS system. And we have some examples, I think, where we can look. But anyway, what does CRVS system do for women? They provide sex disaggregated demographic data. They're a gateway for women and girls to exercise their individual rights and protections. And they can prevent passing the disadvantage between generations. The first time that I realized the importance of CRVS systems, and actually was working at the Inter-American Development Bank, because it turns out that in Latin America, and you know, you have not brought up Latin America very much today, but one of the main problems, a real issue in Latin America, is that there are a lot of consensual unions. People don't get married. And historically, there have been significant proportions of women used to not ever get married. And what happened, particularly those that were the unwed mothers, the unpartnered unwed mothers, they were not married, they could not register the children, and that passed the disadvantage from women to both boys and girls in the system. So the unregistration, and that's why on the national level you don't see that many gender differences in CRVS system. But the problem is that mothers, particularly those that do not have registered marriages, that are in consensual unions, pass on their disadvantage to their children, which end up not being registered at birth and then suffer incredible consequences of the intergenerational transmission of poverty. And there's very good research at the Inter-American Development Bank that has done on this very issue. So, if you register women, and if women have registered marriages, you can also, those mothers will register their children. So the non-possession of birth registration is more of a problem for women than it is of a problem for men. And we have already said this morning why, and one of the main reasons is early marriage. If you do not have a birth registration, you don't know if the person that you're marrying is underage or not. But there are a lot of other things that birth registration and legal identity, and here I'm bringing in also, I think that we need to talk about legal identity and ID for development, what they do to women. And they provide a range of rights and opportunities for women. And they include financial services, voting, education, and healthcare. And I will tell you a little story of how CRVS, the CR of CRVS, has helped with data on financial services. The government of Chile in 2002 decided they had a performance-based budgeting system that they were going to implement, so they had to track the performance of all the different institutions and disaggregate it by sex. So they asked all the banks in the country, the Superintendency of Banks, which is the central bank, asked all the banks in the country to please start giving them supply-side data on financial services disaggregated by sex. But the banks, the banks in the country didn't have the data because they had never sex disaggregated their client base. So you know what the Chilean government has very good civil registration statistics. So the first year what they did is they paired the civil registration with client information, with the bank clients to decide which was the sex of the person. So the way the Chilean government and the way that the banks ended up disaggregating their client population by sex was thanks to a very good civil registration system. Later on, the banks started started doing it by themselves. But that's one of the applications of a very good civil registration system. And like that, there can be many more. And in fact, they could even become profitable applications. And people could start charging for the data. So anyway, non-possession can also affect the rights of widows. And, death registration can provide important data, right, that we have already been talking, but it also, non-possession of a death registry can really affect the rights of widows. Second, non-possession of a marriage registration can really pass the disadvantage between mothers and children. And we have already talked about this. So essentially, in general, CRVS is essential for population data as a denominator. And we have been talking about this a lot today, and it is essential for the SDG targets. If we're going to measure the SDG targets, we really need good denominator data, and CRVS does provide that. So let me give you some examples of the work that Data2X has been doing on CRVS, and I have to say that we have been collaborating in particular with ESCAP and with ECA, and it has been a great collaboration, and we're very grateful to them. And we really, I think that these regional commissions are a very good example of how CRVS and gender and CRVS is really taking on sort of a much sort of bigger portfolio in these regions because of the work of the commissions. Examples of research findings that we have put together. One is, as we had said, that gender gaps in birth registration can be very small at the national level. But then once we go into the data, and we have done this with data of the DHS and the mix, you can start seeing that there is substantial underestimation there can be at the subnational level. And particularly, and interesting is particularly among those populations that can be the most discriminated against, and or that are populations that are sort of described by cultural issues, not by economic issues. We did an analysis of data for sub-Saharan Africa for 33 countries, and one of the main determinants of under-registration in birth for girls, for women, was polygamous marriage. In countries with polygamous marriages, you find significant under-registration of girls in countries or in regions within countries. And that's the most important thing. It's not even at the national level, but within the region. Now, female deaths are less likely to be registered in China and in Rajasthan, as my colleague will I think, show you. And not only sort of there's an issue with birth registration and with death registration, but also there's a gender issue with ID possession. In Pakistan, there was a 6% gender gap in ID possession, the possession of a legal identity document, in the 2012-2013 survey, and particularly this was highest in the poorest 3 quintiles. So the problem of birth registration and of ID is always higher in the poorest populations, and obviously those are the ones that suffer the most. So 55% of couples in the poorest 30% of the population in Indonesia have only religious marriages. They don't have a certificate, a marriage certificate. Well, 75% of the children in these couples are not registered at birth. In Nepal, widows can have a widowhood pension only if they provide the death and citizenship certificate of the dead husband. If they don't have it, they don't get a pension. And this is a really interesting data that a Data2X researcher put together. Nepal, the Nepal Cash Grant Program requires a birth certificate to enroll children under 5. So birth registration increased dramatically in the target populations that were in some sub-regions in Nepal and for poor Dalit households compared to the rest. And significant pre-program gender gap in birth registration disappeared, but only in these regions. So, which shows you that the incentives, the right incentives, can really make a difference in bridging the gender gap in birth registration in this case. So, what do we need? We need to reduce the existing gender gaps in CRVS and in access to adult ID, right? And we have to figure out what are the proximate constraints and the underlying factors that give rise to these existing gender gaps. We need to improve the available data on gender gaps at both the national and subnational levels. And I think we really do need to do the business case and the costing exercises for gender and CRVS. And more detailed research on the benefits of CRVS for gender equality are very important. And finally, I think we need the funding and capacity support to CRVS, but very importantly, with a gender lens on CRVS. And I think that my final message here is it's incredibly important what you're doing here, which is to integrate a gender lens into the regular work of the national statistical offices and the international statistical systems that are doing the overall work on CRVS. We cannot let this be marginalized into a women-only or a women-specific initiative. It is terribly important, I think, that you continue this work in an integrated way. Thank you. And I forgot to mention, you will be getting, there's a little flyer here on with data on CRVS.
Thank you. Thank you, Mayra. Thank you, Mayra, for so eloquently explaining and setting the stage on genders and CRVS. I would suggest we are moving now to see an example from the country level and invite Josie here to share how the Philippines are tackling the issue of gender and CRVS.
Good afternoon. Oh. Okay. Actually, okay. How do we address the gender issues in the Philippines? But before I will do that, let me tell you about the importance of the civil registration and vital statistics in the Philippines. Okay. Now, do I need here? No, so okay. Actually, it's an ideal source of statistics on important demographic processes such as fertility, mortality, and nuptiality, which in turn are the basic information needed for monitoring population growth. But we have other sources of information on civil registration, that is the demographic health survey, and we have also the mix. But there are advantages of civil registration and vital statistics that cannot be taken from any of the sample surveys. One of that is it generates records which are relatively free from certain type of response errors and are not subject to sampling errors. It provides statistical data continuously for planning, administrative, and research at different geographic or administrative levels. It is relatively inexpensive than conducting surveys. It provides an inventory of events which can be evaluated against other records such as census data and other surveys. Okay. For the CRVS documents that we have in the Philippines, we have the three documents type of documents: the birth documents, the marriage, and the death. There are several data items included in these documents, like birth. There are 20 data items, more or less. Marriage, more or less 12 data items. And that documents, more or less 27 data items. This can be disaggregated by sex, but there are other issues, gender issues, that cannot be solved by just merely doing the sex disaggregated data. In the past, what we have done for problems relating to gender, like legitimation, the lack of information for fathers, okay, and also the birth registration of children going to school, okay. We have, the statistical office have indulged or have been involved in several collaboration with the local governments and also the lawmakers for them to revise, for them to create or enact a law. Like, for example, in legitimation, there are two laws. One is for legitimizing the children born of parents under the marrying age. The marrying age in the Philippines is 18 years and above. If you're below 18, you cannot get married. That's according to the Family Code of the Philippines. And then also, there is also another legitimation process for the birth certificate, that is the use of the surname of the father. Just in case there, in the birth certificate there is no information about the father. Okay, so, but aside from these issues, there are also other issues concerning the quality and the timeliness of the data. One is the delays in producing the vital statistics due to delay submission of documents from the local civil registrars to the PSA. Another is the typographical errors in the entry of sex in any of our civil registry documents, as well as the errors in the names and the date and birth and month of the birthday. Another one is the duplication in registering births, deaths, or marriage. Okay, how do we solve this? One is we are foreseeing of revising the civil registration law. Okay, and then under this revision is for us to have directly supervision, direct supervision for to the local civil registrars, and at the same time, we can all modernize the civil registration system at the local civil registrar's office, and then, but this revision is still ongoing, and then also we want to facilitate the premium annotation of birth, the correction in the birth, marriage, and death certificates. And in order to also to solve the double registration, we're now looking into deduping each of these documents so that we can remove those duplicates. We cannot do it alone, so we have to partner with other agencies like the Department of Information, Communication, and Technology, who will be helping us in that deduping activities. So thank you very much.
Thank you, Josie. Before I invite Martin Bratschi to speak, I'm going to briefly give the floor to Shaida Badiee to deliver a statement from our colleagues from UN Women who could not make it today. So, Shaida.
So this is a statement from Papa Seck, the chief statistician from UN Women. Imagine me being Papa. If those of you who have met him, you see that you couldn't find two more diverse people. It says, dear panelists and participants, I would first like to congratulate the Center of Excellence and IDRC for convening this meeting and for inviting me. It is with sincere regret that I cannot attend. Whether we're talking about directly contributing to achieving SDG targets or improving statistics to monitor the 2030 agenda, adequate civil registration and vital statistics systems are an absolute necessity. This is especially true when we consider the essence of the 2030 agenda, which is to leave no one behind. Exclusion clearly starts with not being registered at birth, not having a legal identity, not having the right or means to register your child, or not having one's marriage or union legally recognized. These are all fundamental human rights, and needless to say that gender equality is at the core of these issues. For this reason, CRVS is very important to our work at UN Women. In terms of our approach, we first and foremost work to address the policy dimensions of CRVS. Like all other sources of data, the statistical output that we will get out of CRVS systems will be as good as inputs. Just that in this case, the inputs are often deeply rooted in partial patriarchy, including profoundly gender discriminatory laws and policies that make women subordinates to men or prevent them from passing citizenship to their children. We also cannot expect to have quality vital statistics registers if, for instance, pregnant women do not have the resources necessary to attend health centers, or if health systems are generally ill-equipped to address women's and girls' needs. So for us, the starting point for CRVS is adequate gender-sensitive policy, and we try to address it through our policy and programmatic work. The second key point for us is that we see the potential of CRVS to extend beyond just counting births, death, marriage, and divorce. We are currently working on the next edition of UN Women's flagship report, Progress of the World's Women, which is on gender equality and families in a changing world. Something that has become obvious for us is that most of our current data collection mechanism, particularly CRVS census and surveys, do a really poor job of capturing diverse, dynamic, and changing forms of marriage and families, which is a rite of passage for most women and men. These are absolutely critical to understand, but equally important from the gender perspective is to understand what happens after these events. This means being able to integrate CRVS, censuses, and surveys much better than we currently manage to. So as part of UN Women's Making Every Woman and Girl Count program, we are already partnering with the UN Economic and Social Commission of Asia and Pacific to strengthen the integration of gender in the regional programs, and we hope to do the same with the Economic Commission for Africa. In those two regions, and in Europe and Central Asia in 2018, we plan to undertake regional reviews on the potential of using administrative sources and programmatic data, including CRVS, to improve the monitoring and gender-related SDG indicators. The resulting product will be a practical guide on best practices across regions to use and integrate these different sources to improve gender statistics. This is obviously a starting point for UN Women in this area, and going further, we intend to substantially scale up our work in this area. So it would be a pleasure to pursue potential collaboration with the Center of Excellence. Many thanks again to IDRC for convening this timely meeting, and I look forward to following up on the outcome. Best wishes to you all.
Well, thank you very much, Shaida, and colleagues from UN Women. I think that these are very inspiring words, and I see a little bit of, low moods and perhaps low sugar into the room. So may I ask you to quickly stand up and turn to your colleagues on the right, shake hands, and say your name and your country, please, so that we are moving a little bit further. And with this, I am. Thank you very much, colleagues. I mean, you've been very collaborative of that. I am just going to invite our colleague from Vital Strategy, who I think is now in conversation with Josie, but to share with us a little bit about the work Vital Strategies is doing on legal frameworks and how you are supporting the country level, perhaps taking stock of what was said today about the importance of legal frameworks.
Yes, great. Thank you very much, Irina, and it's a good thing to freshen up everybody. So along the lines of the introduction that Irina gave at the beginning, I will try to talk a bit to the topic of the CRVS system strengthening strategy initially by giving you a brief overview of the Data for Health initiative. And then I have a very brief PowerPoint presentation, but then another slide on this topic of the legal review work that we've done, and which brings it back more to the gender issue. So just on the Bloomberg Data for Health initiative and the CRVS program that we have, we work in 20 countries and cities around the globe, supporting governments to strengthen CRVS systems. And in terms of the system strengthening approach, which I think is relevant for this panel discussion, what we're trying to do is really work in a very collaborative approach at the national level. So that means that we have strong partnerships with the Civil Registry, of course, but then also with the Ministry of Health and with the National Statistics Office. And as a matter of fact, through our initiative, we are also trying to strengthen the collaboration between these agencies, and I'll get to that when I talk a bit more about the activities that we have. One other approach that is very important to us and that we try to instill in all our activities is to make sure that the activities that we support are country-owned and country-led, that we build national capacity in all the areas of CRVS that we're supporting, and that our activities are set up in a sustainable way. That may at times mean that it takes a bit longer for things to happen, but at least then it's really a system change that will last. In terms of the actual activities that we work with in these countries, and we're calling them interventions, and you can see here the four main interventions are listed, with the first one being this governance and coordination, and that's the point that I was trying to say with fostering the collaboration at the national level. Specifically, this means supporting national CRVS steering committees so that there is coordination and coherence in CRVS activities in the countries, that the ministries, the different ministries involved come together, work together, and collaborate to achieve what's possible in their CRVS system. We then support countries to increase the notification and registration of birth and death, looking in particular at the link between the health sector and the role the health sector can play to achieve civil registration of babies that are born and individuals that pass away. We then, as the initiative, have a focus on birth registration and in particular also on obtaining high-quality cause of death data. So we support medical certification of cause of death and ICD coding, mainly with training, but also with establishing systems so that there is a clear process to obtain high-quality cause of death information for individuals who die in hospitals. And then also, and this was discussed briefly this morning already, introducing verbal autopsies into the routine processes of civil registration. Because, of course, in many of the countries that we're working in, there's a high proportion of individuals that die outside of medical care, where verbal autopsy is really the only way of obtaining cause of death information. And maybe just another small comment related to the discussion this morning is that we actually see that changes to the CRVS systems and real improvements are possible. And our initiative is not a huge sums of money that we're bringing to the countries that it takes really vast amounts to change these systems. It's small funding with technical assistance that allows countries to improve their system. part of that technical assistance is with regards to the legal and legislative frameworks of the CRVS system, and that brings us back a bit more to the gender point as well. So we have developed together with others, together with the Center of Excellence actually as well, a tool for a review of CRVS legal frameworks. We've applied this in over 10 countries, and actually Philip Sattel will be here and giving a talk tomorrow in session 6. And this goes a bit to the point of the biases that was discussed this morning. So with this tool, our aim is to promote international best practice, as outlined in the many documents, of course also in principles and recommendations and other WHO documents and so on, to achieve universal civil registration. What that means, and I think it was Surgeon who mentioned it this morning, is that the guidelines are very clear. It should be universal, and that's the recommendation. However, the way it's implemented in countries, at times there is some discrimination. There can be gender-based discrimination. So what we aim to do with the legal review is to identify those possible sources of discrimination and make sure that there is no discrimination in the legal framework. Because if there's discrimination in the legal framework, there will for sure be discrimination in the real world or in the way it's implemented. Now, and this was also mentioned already this morning, one gender-related issue that has come up in these reviews is the requirement of needing the name and the signature of the father, which of course is, on one hand, it's the right of the child to know both parents, but on the other hand, in some situations, this may also just not be possible, and there should not be discrimination against children or mother for which the father, for mothers or for children where the father cannot be named. And one point for the discussion, I think, is that how this partnership in CRVS, and comes a bit back to my first point, is how the partnership of CRVS can help to strengthen the partnership that we're building in D4H, how it can help to strengthen CRVS systems. And we can maybe talk about that on the discussion later, but I think it's critical. CRVS is multidimensional. It involves multiple ministries. There is no way of achieving progress without involving all the stakeholders that need to be at the table. Thank you.
Thank you very much, Martin. May I invite Romesh to talk about sex differential and CRVS? And he's our last panelist, so I'm inviting you all to prepare your questions for the Q&A session.
Thanks so much, Irina, and it's a real pleasure to be here. And I really want to thank our hosts, IDRC, for bringing us all together and really positioning gender equity at the center of CRVS strengthening initiatives. And also really want to thank the government and the people of Canada for their own leadership in supporting CRVS strengthening through the GFF and their own support to UNFPA. So as Irina mentioned, I'm going to talk a little bit about the current evidence base on sex differentials in and sex effects of under-registration of different vital events. I want to also just mention that this work is joint work with some fantastic colleagues at the UN Population Division, Patrick Jalande and Kai Zhang. So there's actually been substantial recent data from international survey programs and national household surveys that show that there's actually very little sex differentials in birth registration completeness. And that's regardless of the overall level of completeness, as shown by this graph, and the region of the world. But we actually know much less about the gender dimensions of marriage registration and death registration. As Rachel Snow, my colleague, mentioned earlier this morning, there's a noted disproportionate effect of marriage under registration on women and girls. My focus today is going to be more on death registration and the importance of death registration with regard to property inheritance and access to financial entitlements. Sadly, though, we don't have sex disaggregated data readily available for all countries. This is data put together by colleagues at UN Statistics Division, and unfortunately, we don't have sex disaggregated data for death registration completeness. So what I'm going to show you is some very preliminary work that we've been doing to try to assess the possible existence of sex differentials in death registration. So what I've done is I've applied some indirect demographic methods, which Rachel guided us through earlier in the morning, to the available intercensal birth and death registration data, and data from 2 censuses, for Morocco and for Kuwait. While there's no evidence of a measurable sex difference in death registration in Kuwait between males and females, there is a substantial one for in Morocco. On average, a male death is twice as likely to be registered in Morocco than a female death. About 65% death registration completeness in Morocco. Now, in 2004, there was a substantial revision of the Moroccan family code, which really focused on 2 particular areas in enhancing the rights of women in terms of equality within the family. And in terms of increasing the rights of women in the household at 2 particular levels, where husband and wives are now provided joint responsibility in family matters, and women no longer are required to be obedient to their husbands in return to exercise their rights. So what this provides now is an opportunity, and so with the availability of more recent census data, particularly from 2014, and the intervening registration data between 2000 and 2014, we now have an opportunity to evaluate the actual effects of the family code on the completeness of death registration by sex. And what we want to do now, in partnership with the center, is marry that with qualitative and ethnographic analysis to really understand the effects of patrilineal traditions in female death registration patterns, and also the sort of contextual incentives and disincentives around events associated with death registration, like the burial permission process and different aspects of financial inclusion in rural Morocco. This is largely, and I'll underscore this, a story about rural women. Because of regulation around the disposal of human remains in urban cities in most parts of the world, and including Morocco, there is no sex differential. We understand there to be no sex differential in urban Morocco. So, but we want to expand this work further. So there's, in terms of a future direction, what we're looking at now is studying the UN Statistical Division data on death registration completeness alongside of OECD data from the Gender Institutions and Development Database. This is an expansive data set of 160 countries worldwide, which contains very comprehensive information about female inclusiveness, about discriminatory family codes, violence against women, sex norms around asset and property ownership, a very, very rich repository of information. So what have we been doing? We've been applying multinomial logistic regression models and random forest tree decision tree analysis to these data. We've been looking at the death registration completeness data in these sort of 5 categories of completeness, and against the key sort of gender inclusion components, like the equality of inheritance rights between men and women, and the equality between men and women in terms of non-land assets holdings and land asset holdings, as well as information about attitudinal survey information about women's participation in different parts of the education system, as well as administrative data on the proportion of land titles held by women. what we find through the random forest decision tree analysis is that really what's most strongly associated with death registration completeness, death registration incompleteness, is inequality in inheritance rights and inequality in the land and non-land asset holdings. In terms of like targeting, a specific expansion of this kind of work beyond Morocco, what this sort of suggests to us is, a cluster of countries which might be important to look at these data further. In particular, countries where the death registration completeness is reasonable, like not terrible, so in the range of 60 to 70%. And where there's high inequality, particularly in inheritance rights. So beyond Morocco, we've identified Bangladesh, Saudi Arabia, Jordan, potentially even Tanzania. And so the key take-home messages from this work at the moment is that marriage registration and death registration are important, yet highly understudied, but have a profound effect on gender equality. And as colleagues this morning were noting, we need to understand the interdependence of registering different vital events. Further, there are still major data gaps on marriage registration and death registration, completeness by sex, even in the face of demanding calls around the 2030 agenda for disaggregation, not just along gender lines, but many other lines as well. And that sort of brings us to the Morocco example where there's real opportunities here to use the 2020 census round and other data systems to assess potential sex differentials in death registration completeness. And this possible way forward of marshalling other information, both qualitative, but even databases like the OECD's Gender Inclusion Database, to identify areas where this kind of work could be fruitful to drive, as I think what Montasa was calling, inclusion of gender by design in CRVS strengthening, as opposed to strengthening of CRVS systems and gender sort of coming along as a sort of artifact or a side effect. Thank you.
Thank you very much. Oh, I'm okay, I don't hear. So thank you very much. I think this debate was really interesting, and I'm going to invite the colleagues here and participants to ask questions, take advantage. Not many, though, because we're going over time. So the two mics are there, and the floor is yours. And don't forget to say your name and the organization you're coming from. Courage. Yeah, please.
I'm Rachel Snow from UNFPA. I have just a question about polygamy, and I'm wondering if any of the panelists can unpack the story of polygamy. And is that polygamy universally across many, many different countries, or is it a combination of polygamy situated in a particular place and time? There was this comment made that it's in polygamous marriages that there is a particular under-registration of the marriage, and I would love to know a little bit more how that can be unpacked. Thank you very much.
Thank you. Maybe we take two more questions and then we let the panelists respond. Monsieur Yomo.
Well, thanks very much. Thanks very much for giving me the floor. First of all, I'd like to congratulate the panelists for their brilliant presentations. And as my contribution, Ms. Irina, I'd like to say the following. I'd like to say that our deficits in terms of registering deaths of children and women could also be a factor due to the flexibility of the legislation in specific countries like mine, Cameroon, in which if you want to bury someone, you don't need authorization, official authorization. It's not something that's prescribed by a law. In other countries, so this is not the case. But if we did have this legislation in Cameroon, it would give us more data on the registration of deaths. I'd also like to draw a link with the following, and I think that this has already been broached by the panelists. Inheritance, pensions, that's linked to the registration of the deaths of women. Now, in principle, traditionally speaking, women don't inherit. Women, when they don't have a retirement pension, they really can't have their deaths registered either. Now, in specific countries, there are traditional type marriages, so this is the case in Cameroon, in my country. But in Cameroon, we only register officialized civil marriages. And finally, I would like to deal with a specific issue. I would have liked the panelists to look at this issue, the issue of the registration of births, births that are out with the law. We have a solution in Cameroon. We have a census of all children whose registrations are not done in the prescribed period. Any further questions? If not, I'll give the floor to our panelists to them to answer those questions.
I'd like to answer Rachel's now question, Mayra, or Romesh or Martin or Mayra. Would you like to try?
Yeah, sure. The polygamous. It was we used, I think it was DHS data for 33 African countries and looked at the registration of infant births. And the factors that were associated with under-registration of infant births, both of male and female infant births, were the mother is young and the mother is in a polygamous marriage. And the third factor is the mother gave birth outside of hospital. But the strongest relationship was between the mother is in a polygamous marriage. That mother had much less likelihood of registering the births of her children. There was no determinants in terms of education, and economic status were not significant at all. So, the conclusion was sort of if the variables that are really affecting this are much more on the cultural side than they are on the economic side.
Thank you very much, Mayra. Anyone else would like to try about the late registration question from Cameroon, our colleagues? Martin, maybe?
Well, maybe I can talk just to the issue of the burial permits. And I think that we do also observe that some countries don't have. And I think it is, as you point out, it's a gap. And it's, I think, having structured burial purposes will become more and more important also as populations get bigger, and in urban areas, for sure, it's very important. And having the need for a burial permit, of course, is a very valuable tool in terms of registering the death, because they can be, or they should be, linked, so that you, in the process of obtaining the burial permit, you get the death registered. So I think it's a very powerful tool to improve death registration.
Romesh?
Yeah, thanks. Just picking up on Martin's points, I think this is a huge area which we need to understand a lot more of. Colleagues from UNICEF and Plan International have done excellent work over the years in helping us understand the importance of birth registration and the incentives around birth registration, like immunization and access to free primary education for the child. We know very little about the incentive and disincentive systems across different cultural contexts for marriage registration and death registration. And this point about late registration really, highlights this kind of issue, because often these sort of late registrations turn into non-registrations if the CRVS system is an island out there by itself. And I think this speaks not only to, the importance of the interdependence of the registration of different vital events, births, marriages, and deaths, and et cetera, but also the interdependence of other systems, the burial system, and other things. And so I think there's massive scope for to do that kind of research to understand how these can be better linked, which I think helps us come back to Irina's opening question, which is, communities know about vital events. Why is it the civil registration system, doesn't for certain people? And how do we harness that kind of community-based information?
Thank you very much, Romesh, and thank you very much, all of you. I think that in the interest of time, we will maybe we'll take 2 more questions, because we did these energizers, and then I'm going to take 1 minute for the concluding remarks, and then it's over. So who would like to, Marwan, and then Sana? Very briefly, please. May I invite you to the mic, and the colleagues in the response, may I ask you also to be very, very brief, because we went over time.
Thank you, Irina, and thank you very much for very interesting intervention. I just have a comment about whenever we go to countries, work with them in the statistics, and they tell you, deaths cannot happen because they need a legal permit to bury, so it must be complete. And in practice, it's one thing, the legal requirements, and another thing is the incentives for people to do it. So the implementation phase is actually more important, and I agree with you, it's important, but it doesn't really take care of the registration. It's just a comment, your thoughts on this. For Romesh's presentation, just briefly, very interesting, of course. The Morocco results are exciting. For your other part, when you use cross-national data, my question is that how confident are you about these kinds of data? I know that the estimates for death completeness published by UNSD is actually problematic, I would say, although I belong to that system. These are reported. My understanding, surgeons here can correct me if I'm wrong, but they can actually be very off. Like in Egypt, for example, we know death registration is not complete, and yet it's over 90% complete. So I'd like your comment on this.
Thank you. Maybe we take Sana's questions and then you respond.
Yeah, I have a comment more than a question, just to underline the importance of qualitative research and gender analysis within research when we talk about gender. Because as was addressed in the morning, Oliver highlighted, it's not only sex disaggregated, it's not only statistics, there is a story behind these statistics. And how to identify, underline the story behind the statistics needs more in-depth research, qualitative and gender analysis component. Thank you.
Thank you very much. So would you like to answer Marwan's question?
Yeah, thanks. Thank you, Marwan. Yeah, well noted. You're absolutely right. The data that we have on death registration completeness is really drawn from 3 sources, DHS surveys, mixed surveys, and then actually self-reported information from the national authorities themselves. And in some sense, we worry a little bit about perhaps some of the optimistic assessments by some national authorities in terms of death registration completeness. I'll just highlight, though, that the way that we're using those data in this analysis is more of a diagnostic tool, a quick diagnostic tool to think about how to expand this work a little bit further, and not really the sort of last point on death registration completeness at all. Thank you.
Thank you very much, Romesh. And before I make the concluding remarks, I have a question for each of you, actually. it's the same question, and I'm going to request you to be 1 minute each, not go over. And the question is, what should be the next steps for strengthening CRVS systems and ensuring that gender dimension within them are not overlooked? And let's do it the other way around. Start with Romesh and go down to Mayra.
Yeah, thanks, Irina. Well, I really hope that the next steps from this particular meeting and the Innovation Conference on Tuesday and Wednesday is really that we generate a vibrant community of practice around field intervention studies that underpin CRVS scale-up, which have a real gender lens to them. I think there's a lot of excitement and political will around CRVS strengthening, but we still lack the operational research around what works, why it works, and how it works in different contexts.
Thank you very much. Romesh, Martin?
Yes, just picking up on the points that basically were already raised, I think for the gender point, it's really critical that there is no discrimination in the legal framework. And I mean, also answering the question I agree that the legal framework is just the foundation. It's not necessarily what happens in the field. But the foundation must be right. And then we have to ensure that also implementation is without any discrimination. And then I think for the system strengthening overall, this aspect of coordination among the national stakeholders involved is just critical. Thank you.
Thank you. Josie?
In the Philippines, actually there are many steps or many action plans for improving the CRVS. But one of this is right now we are reviewing the different forms of the CRVS documents so that we can identify which data items are missing, or we can solve the data gaps for specifically in producing gender statistics out of that CRVS documents. And then the second one, for the underreporting in that registration, we found out that it's a tribe, the Muslim community has this, they do not register their deaths or any dead relatives. They just bury. They do not follow the law of the land. But we are discussing on how we can encourage them to register the deaths. Either maybe we're going to use again mobile registration the way we did it for the birth registration.
Thank you very much, Josie and Mayra.
Build the business case for gender and CRVS, the benefits to gender from CRVS and the benefits to CRVS from integrating gender.
Thank you very much, Mayra. And with this, I would like to really conclude this panel. And thank you very much for having participating and colleagues contributed to it. There seems to be indeed a knowledge gap in gender and CRVS. And in the future, I think it would be important to research key questions on women and CRVS. I mean, who are the unregistered, where they are, why they do not register, and also be innovative and further look at the economics of CRVS or how we can better support countries, improve their legal frameworks into the future. And it is also up to us to explore the known unknowns, also the unknown unknowns, because there seems to be many, right? And we also would need to pack a little bit better the policy lessons from research, and better articulate them, as a matter of fact. And as it comes, we do not only need research, but we need better evidence and package better the results of research for policymakers to address these issues and for the stakeholders to improve and refine the nationals, all the local strategies for system improvements. And last but not least, it would be critical to involve women and girls into the design and implementation of solid and sustainable civil registration systems, and to ensure that all vital events pertaining to women and girls are also certified and registered. Thank you very much for your participation.